Next week, the nation will celebrate the life and legacy of Martin Luther King Jr. MLK was a champion and crusader for many causes related to inequality among people. And one of those focused directly on health and health equity. MLK famously said, and I'm quoting, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane," end quote. Here today to talk about health equity and the work that is happening around it in our communities is Lynn Todman, who is Vice President of Health Equity at Spectrum Health. Good morning to you.
Good morning to you.
Thank you so much. So can you please explain health equity? What exactly do those two words mean?
Yeah, health equity means that there are no unfair or avoidable differences in health among different groups of people or communities. It means that everyone in all communities, regardless of their social or economic status, their racial, ethnic, or gender identity, where they live, urban or rural communities, their country of origin, regardless of all of those attributes, that they're able to achieve their optimal level of health.
So Lynn, historically, this isn't really about making sure those underserved populations throughout history have access to a quality health care. It's that they get their regular checkups too?
Well, those checkups are too, but you think about it, those checkups happen maybe once a year. But what really contributes to health is what happens the rest of the time when you're not in your doctor's office, where you live, where you work, the kinds of food you have access to, the kinds of housing you live in, whether you live in a place that has clean air and water. Those are the things that contribute most to health, and those are the things that contribute most to health equity and inequities.
So how do we go about achieving health equity?
That's a tricky question in our nation because we haven't really done that to date in 400 years. There have been many, many noble efforts. One of the most significant efforts was the civil rights legislation of 1964, which included Title VI, which made it illegal for any entities receiving federal money to segregate. Shortly after that civil rights legislation was enacted, Medicare came on the scene, and then it became illegal for any hospitals receiving Medicare funds to segregate. So that within a series of just a few months, more than 90% of the hospitals in the United States were desegregated. And it was during this time that Dr. King made that statement about, of all the forms of injustice, of inequality, injustice in healthcare is the most shocking and inhumane. He made that comment as the Medicare legislation was being crafted and as it was becoming clear that it would be subject to Title VI and that hospitals would not be able to continue to segregate their wards. In the aftermath of that, we did see declines and disparities in death rates between Black and white babies. There were many other things happening at that time, but certainly the desegregation of hospitals in the mid-60s played a role. So that's an example of the kinds of things that have been done in this nation to address health inequities.
And feel free to throw any other examples that you like as well, but also let the community know what Spectrum is doing, what's taking place.
Yeah, I mean, Medicaid expansion, we know that in expansion states that we've seen better preterm outcomes, infant health outcomes, and narrowing disparities between Black and white babies in those states where there's been Medicaid expansion. With respect to what Spectrum Health is doing, we're doing a lot. We are cleaning up our data collection processes so we're able to better identify and address actionable disparities. We're reforming our organizational culture so it's more supportive of human diversity, different ways of thinking. We're putting accountability structures in place to make sure that we do the things that we say that we're going to do, and launching programs around housing and community safety and cardiovascular health and maternal and infant health. And that's just a small sampling of the many, many things that we're doing at Spectrum Health to address health equity.
And Lynn, finally today, what advice do you have for people who want to better understand and work toward health equity in their community?
Yeah, I think one of the most important things that we can do is to be in relationship with the people who are experiencing the inequity so we can deeply understand what their day-to-day is like, what the issues are, and engage those individuals in the process of problem solving and creating programs and initiatives to actually narrow disparities. The other thing I would say is to embrace the concept of allyship. This work cannot be done in silos. It takes lots of different worldviews, perspectives, levers, assets to do this work. So I would say work with others to advance health equity. It's really critical that we do this in collaboration and partnerships.
Indeed. And on that note, thank you so much for your time this morning.
Thank you for having me.
Absolutely. And to learn more about what Spectrum Health is doing when it comes to health equity and Martin Luther King Jr. Day, simply go to spectrumhealth.org.